Okay, so just to plow through the rest of this, medications for Alzheimer's. Not real promising at the moment. They're indicated for mild to moderate Alzheimer's. I don't know if people know patients who are taking the medications. It's questionable how effective they are. I guess in the laboratory they're more effective than in real life, but since they're there and they can potentially help, why not use them? And this is a reason because they're there, it's helpful to have a diagnosis made early, because if they can have any effect, then you want to start the patient early, because then that is when they're indicated. At this point, we don't have a medication that's going to stop the disease process. You know, there's no vaccine, there's been experiments, but nothing has been too promising at this point. But there are those medications, and they affect acetylcholine, and they block the enzyme that destroys acetylcholine. Modest improvement of memory and cognition, and those are the names of the medications. Aricept seems to be the most common. Some of the others, the last one, Ramnil, I believe can cause liver problems, so that's avoided. Yeah, so maybe you've seen the others used. So these acetylcholine medications are also sometimes called smart drugs. They increase the concentration of acetylcholine, and then so the transmission between the neurons are improved. And there is research being done with the military and pilots to improve cognition and ability to function, and that's why they're called smart drugs. There's another medication, Nemenda, for moderate to severe dementia, and it works a little differently. So on that, it antagonizes that NMDA receptors. Just to back up to mild cognitive impairment, this is something that's more recently been discovered to be occurring. It's cognitive impairment that doesn't interfere with daily activities, but when a person is tested, there's impairment in neuropsychological testing. So there is difficulty with memory, and studies have shown that it could be a precursor to Alzheimer's. Okay, so we went over caregiver issues, and the average age of the caregiver is 60 years. So that can be very trying on the person of that age. Most are women, and there's a high incidence of depression with caregivers, especially when it's a prolonged situation. And most people do live at home who have dementia. So the daily challenges of Alzheimer's, wandering around, and so things can be implemented like putting door latches at the bottom of the door so the person doesn't wander outside. Having family meetings, involve as many people as possible. You can keep files, healthcare files, and respite care is important, and involvement in support groups. And in your handout you'll see these different resources for, I think they are for Alzheimer's. And then there's the books that can be helpful for family members. In the video she referred to, I think, the 36-hour day.